Hi, and welcome to the Green Nurse Podcast. My name is Amie,
And my name is Sarah.
and we are your podcast hosts. We want to talk to you today, and thank you, all of the nurses all across Canada, and because this is a special week. It is National Nursing Week, and we are so proud to be nurses. And we want to say thank you for everything that you've all done. And we have a special episode for you today.
We have the biggest guest that we've ever had. All of you are going to know him within Canada, outside of Canada. It is none other than the Prime Minister of Canada, Justin Trudeau. And so you'll definitely want to tune into this one. It is a really good episode. And without further ado, here is a quick word from our sponsors.
Attention hospital HR in Canada. Are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Hi, and welcome to the Gritty Nurse Podcast, an unfiltered and unapologetic podcast which discusses health and healthcare. My name is Amie.
My name is Sarah.
And we are your hosts.
Don't forget to hit the subscribe button wherever you listen to podcasts, Google, Spotify, iTunes, or our YouTube page. Please rate and review us.
Make sure you get our book, The Wisdom of Nurses. There's no better gift than giving the wisdom of nurses to nurses during Nursing Week. Hi, everyone, and thank you so much for being able to have this conversation with us. I cannot believe that we have the Prime Minister here to talk to us, doing this interview during Nursing Week. So thank you so much for showing up for nurses. And I think Sarah has a little something she wants to add too.
Yeah. So, Mr. Prime Minister, you may recall we met about a year ago at the International Council for Nurses. And I have a little story to share you. We actually mentioned you in our book, The Wisdom of Nurses, because when I met you, I very discreetly looked down at your hand and I noticed you had very good veins.
Nurses are always assessing.
And so this is something like once you're a nurse, you're always a nurse. You always notice these kinds of things. So I just wanted to share that with you.
I remember that meeting well. We had a great conversation. It was really lovely meeting you and you, Sarah and Amie. But I always say when I go in to get my blood taken or an IV or anything, I say I will give you one chance. The veins I have, if you I used to be scared of needles, and then when I turned 17, I started giving blood to try and shake my fear of needles. What kid likes needles? But I always used to say, listen, if it takes you more than one, maybe two tries to find a vein, then maybe this is not today.
Yeah, no, I mean, we have a 1-2 poke rule too. That is actually a nursing rule. So never fear. In this episode, there are no needles. Nothing sharp here. But before we get started, I think it would be good to start off with, do you have a message for nurses across Canada for this week?
Listen, thank you. Thank you for your commitment to Canadians, your commitment to community, for the incredible work you do, keeping Canadians not just well, but reassured that there's a system there to take care of them. I mean, as you guys know, you're often there on someone's worst day ever, and the way invariably you are present for people with your whole being is just humbling for anyone who is watching your dedication to community, to individuals, and to people. It's overwhelming. So I just want to say thank you for everything you do, everything all the folks in the medical community do every day to respond to people who are in distress in so many different ways.
Yeah, thank you so much for that.
Thank you so much. We really appreciate hearing that. And we want to ask you actually if you could talk a little bit about the role of the government in relation to healthcare and nursing, because I think this is something that not a lot of people understand.
Yeah. Well, when we got elected in 2015, the first time, we had made commitments around home care and specifically around mental care, $5 billion for mental health, that we rolled out within about a year and a half, I think, across through health deals with the provinces. It was $5 billion. And unfortunately, over the following years, I kept asking, okay, so, how is that $5 billion landing? And everyone's like, oh, no, it just got absorbed by the provincial systems, and they're in charge of delivery. So you can't put strings on it. You can't dictate how it's got to go. The Constitution says provinces deliver healthcare, but federal government's got to be there to fund a big chunk of it. And I've always I understand the Constitution, those division of powers. And quite frankly, when you look at where the federal government is directly delivering healthcare, whether it's to our military or in Indigenous or First Nations communities, it's not like we're that spectacularly great at it either. I mean, it is not an area in which we excel, so much more than anyone else. So the idea of a federal government attaching strings to things was always a real pushback from the provinces for a whole bunch of different reasons,
Right.
Particularly through the pandemic, where we stepped up in a whole bunch of different ways. I think 8 out of every $10 spent to support Canadians during the pandemic, all told, was directly from the federal government. But we didn't get a whole lot of accountability. So last year, when we sat down with the provinces to talk healthcare and healthcare investments, we sort of said, okay, we're talking about $200 billion over the next 10 years we're putting on the table for healthcare. And we can't tie direct strings to it, but we know, and we've had conversations with nurses, with doctors, with communities, with the provincial systems, and we know there's some pretty clear priorities around primary care teams, around better support for health workers, particularly the frontline ones, and better mental health investments. So we want big chunks of money to go into those, but we can't direct exactly how they're going to go. So what we're doing instead is we're demanding better data.
Right.
Provinces and provincial healthcare systems are going to have to be much more transparent and rigorous and comparable about the outcomes for the money invested in healthcare systems. And it's not accountable to the federal government directly for what they're investing here or there. It's actually accountable to citizens of the provinces, to users of the healthcare system, to doctors and nurses in the system who want to know, whether the investments are actually landing, academics and researchers, journalists, regular Canadians who say, okay, we spend an awful lot on healthcare. Is it working? Are we seeing improvements? So what we've been absolutely ferocious on is saying, yes, the federal government will be continuing to fund healthcare at some of the highest levels ever in Canada's history, but we need better data. And that goes from everything from patients' medical records being accessible as necessary by the pharmacist, by the specialist, by the ER doctor that treats them. Like, all those different people have to be able to have better data to be able to properly serve and get the better health outcomes. but you also have to be able to compare what's happening in one corner of the province versus another corner of the province, what's happening in one corner of the country versus the other corner of the country. There's things we can learn, things we can ensure, and when we talk about supporting healthcare workers, when we talk about primary care physicians and teams, when we talk about mental health, folding that in with a better overlay of high quality data that will lead to better outcomes as well for patients. That's one of the best things we could do, because we can't do it directly, to make sure your healthcare systems across the country are treating you right and giving you the tools. Because as we all know, conditions of working conditions dictate conditions of care and quality of care for the patients.
Right. I think that'll be such a great answer for our nurses across Canada to hear, because again, I would say a lot of the times when we hear complaints or we hear that, we're frustrated, folks don't know what direction to go to. Do we talk to the federal government? Do we talk to the provincial government? And you kind of touch on the fact, because I was going to ask you about accountability, and you said, data will be the strongest point. So one of the things that I'm going to adjust my question here a little bit, how can nurses be a part of, some of this change? Because again, we feel like we're so left behind and we don't really know where to start, and there's not a lot of nursing within politics. How might we be should be writing letters if we're dissatisfied with what's happening with the provinces? How can we be a little bit more involved?
Well, first of all, over the past years, we brought in an extraordinary resource in Dr. Lee Chapman, who is Canada's Chief Nursing Officer, who I know you guys know,
Right.
and who is really leading the charge on things like the Nurse Retention Toolkit, which is a set of best practices generated from the profession that organizations or clinics or hospitals or institutions can draw on to make sure that they're properly listening to and empowering their nurses to be able to do the jobs they need to. But part of it is you spend your time within the medical system as being advocates for your patients, right, in so many ways. That's what you do. You take them on in a personal way, and you fight for them, across the institution, across the system. Part of fighting for them is going to be fighting for better data, for better knowledge, for better understanding, for knowing, okay, if this is happening on the other side of the country and it's really working and it's getting, patient impacts that are really positive, well, we should have that too. And you should know what it is, and you should have access to all that kind of information, and really pushing an improvement of healthcare information, healthcare data, healthcare outcomes in a way that is transparent, comparable, and empowering for the jobs you do, to just add it into the things that you're pushing. Because there's always, a new way of doing things, a new system. There's always a certain amount of resistance to it. But right, understanding how empowering it can be really, really important. So yes, write to us, but also put lots of pressure on your provincial systems as well, because that's where a lot of the decisions are being taken.
Amazing. Thank you for that.
Yeah, that's a really great explanation. And so just shifting a little bit back to mental health and nursing, obviously it's been a very challenging few years for nursing, and there's been a lot of talk about mental health and mental health support. Is there anything that's being done at the federal level?
Yes, obviously in demanding that investments in mental health be part of the health accords that we're signing with the provinces. That is a big push we're making. We've also done a lot of work and investing in various different mental health programs for professionals. It's not just mental health of the patients; it's the mental health of the nurses, the doctors, the EMTs, the various police officers who encounter mental health challenges. Everyone's dealing with various levels of PTSD in the trauma work that they do, combined with the fact that people are still suffering from the after impacts of the pandemic. The acute crisis may be over, but the effects linger in so many different ways that that we all need to be leaning in on mental health. And I think about the stress and the burnout that's happening in so many professions, but particularly in nursing and frontline health workers. And so much of it is not, the job's just getting too hard. I mean, I'll be honest, if you chose to become a nurse, you did that knowing that the job was going to be hard, but you were driven to do it because you knew you could make a difference and you were going to actually serve people and help their community. And when I speak with people who are just burnt out and who just can't do it anymore, it's not so much, the complaint isn't, oh, the job's become too hard, although yes, you're having to do more and more. It's that you're actually not able to do the job you want to do when you're having to handle too many patients in a unit on your own, when you don't get the resources, you don't get the supports you need to be able to actually deliver the quality of care that drove you into this, drove you to choose this extraordinary profession. That is draining on a way that hits your soul. Even more than just being extremely tired at the end of the day because you're working hard, because that's what you signed up for. You're working hard to make a difference in people's lives. And when you're working hard and not making that difference, that is crushing. That for me is the thing that I really, really, I'm wanting to go at and really try and change the approach, which was why more resources, more nurses in general, more frontline health workers, whether it's accelerating international credential recognition, whether it's expanding the colleges and universities that are offering more places and programs to get those reinforcements to arrive, but also make sure that in the conditions of work you're actually able to care and help to the degree that I know you want to, and not get disillusioned because you can't. I mean, that's one of the biggest things we have to turn around.
Yeah, thank you for kind of bringing that out. And I think that, we've talked so openly about mental health and how much nurses need the support. And again, we always say it's okay to not be okay and always to reach out for resources. And we know that there's a new resource from a federal perspective too that nurses can tap into as well. So I just want to make sure that we're doing okay for time.
Yeah.
We can keep going a bit
more. All
right. I'm talking too much anyway. I want to hear from you guys.
No, it's all good. It's all good. One of the things that we're really keen on is nursing in politics. We don't see a lot of it. We do have Dr. Lee Chapman, who's an amazing resource and an amazing support for all nurses across Canada. But how could we be more involved? Like sometimes we don't know if there's other organic things that might pop up that would be of interest and that we could support. So we know that Minister Kamal Kher is there as well. How could we be more involved in politics?
Yeah, well, first of all, I was really, really happy to bring a nurse into cabinet. Kamal is extraordinary.
We were too.
And actually, through the pandemic, she was doing shifts and helping on the ground in her community while she was an MP, and she kept us totally plugged in and apprised on what was actually happening and what was really mattering, and it was unbelievably invaluable. Listen, I'm probably biased, but I think there should be lots more teachers and nurses in politics and a few fewer lawyers and businessmen, to be entirely honest. The idea of service, of community, of being there to empower and support and just connect with people is the most important thing about politics. And that's one of the things that I think when we see this era of a bit more polarization, people aren't connecting with each other. And nurses are unbelievable at being compassionate and professional and present and supportive, and we need more nurses in politics, but there's a lot of ways to do politics. Yes, you can step up and run, and I really encourage that, because we definitely need you, but the activism that the two of you are doing with that extraordinary book you've put out, with the podcast, with building a really strong community, that's kind of political leadership that matters. The activism within your unions, honestly, the relationship that we've had with labor over these past 8 years has completely transformed not just the way this government has functioned, but the impacts it's had on Canadians, recognizing that unions are a key part of building strong communities, of making sure there are good jobs that actually support communities and support families when you get home, that can drive this country forward. Like, there are so many different ways of making your voices heard, and it's just understanding you're already there to be direct advocates for any given patient that steps up. up. Getting involved in politics is just about expanding the patient pool that you're advocating for, because when you stand up and you point things out for all Canadians, like standing up unequivocally for public health care, we need more of that, because quite frankly, there's some really worrisome trend lines happening out there across the country.
Yeah. Thank you so much. That's actually really inspirational to hear that you feel more nurses should be in politics, and we couldn't agree more.
Yeah. But I don't want to take nurses away from the profession either at the same time. But yes, we need more strong nurse voices in public discourse. We have handfuls of doctors in legislatures across the country, not nearly enough nurses, and quite frankly, I think nursing is a skill that translates better into politics in a number of ways, in terms of the connection in the community, than a doctor, not to take anything away from the outstanding doctors that we've had.
That's music to my ears.
Absolutely.
Yeah, absolutely.
This has been such an amazing podcast so far. We wanted to ask you one last question, and it's a question we actually open our book with. So we asked the reader in the book if you can name a famous nurse, and we wanted to put you in the hot seat for a second and ask if you could name a famous nurse or two.
I'd go with Canada's Minister of Diversity, Kamal Khera. I'd go with Lee Chapman. I'd go with I know two extraordinarily impactful famous nurses named Amie and Sara. But at the same time, I'd say last night, it's not the famous nurses that matter the most to me. Last night I was at the celebrating Asian Heritage Month on Parliament Hill, and an elderly woman came up to me and said, "Oh, Justin, what a pleasure to see you. I want you to know I was your father's nurse in Montreal when he was being treated at the Montreal Neurological Institute, because he was dealing with Parkinson's in the last year of his life." And I instantly welled up, and I don't remember meeting her. I might have met her. She didn't mention whether she had or not, but she obviously was touched to be able to say that to me, and I was just floored. And I gave her a big hug, and I just said thank you, because what my father was going through in those moments were incredibly difficult. And as a son, I was trying to be there for him in every way I could, but I knew there were a lot of people there for him, and I have no doubt that she and the entire staff of medical professionals and nurses were impactful. So it's not about the famous nurses. It's about the nurses that don't get thanked enough, that don't get elevated enough, except by the patients and their families that they get to see just doing miracles with every single day.
Yeah, thank you so much for sharing that personal story. And again, that's what we try to do with the Wisdom of Nurses, and even in our advocacy, to continue to raise those stories that most folks might not hear about, to show that, we do have wisdom, and that we are out there every day trying to do our best to make sure that we when patients come in, they leave better than they come in. If not, we try to make sure that they go on whatever journey they can the best way possible. So thank you for sharing that personal story with us. And maybe before we close the episode, if you have any questions for us, please feel free to ask them. And then any last closing words or parting words for nurses for this week?
I guess my question, in all the conversations you've had, and I'm sure you've had a whole bunch of them, with young people, young women and men looking at getting into nursing or getting into healthcare. I know through the pandemic, I seem to meet a whole bunch of people who said, "No, I want to step up and be a hero like those extraordinary people who helped us during the pandemic." What are you seeing in young people that is motivating them? What are the biggest challenges they're facing in terms of becoming health professionals? Are they demoralized already? How do you deal with that? How do you encourage them to power through the burnout? And this is something, this idea of fairness for every generation is really something that this government is focused on right now. And I'd love to hear your perspective on how to get young people positive and ambitious about the country that they're busy shaping every day.
Yeah, that's a great question. I think that people are getting into nursing because, like you said, they want to help others. They want to make a difference. A lot of people are going into nursing as a second or even third career. And what I'm hearing a lot is there's issues within nursing that we don't see in other industries, and that is experiencing violence in the workplace. A lot of bullying that happens in the workplace. Nurses don't feel valued and respected, and there's a lot of just moral distress when it comes to the fact that you can't provide the care that patients deserve. So I think those are some of the issues that we're hearing a lot of.
Yeah, and I would add that, actually young folks are still really ignited and really still want to be nurses. And I think that might be surprising because we did actually see that there was a huge increase of people applying to nursing professions throughout the pandemic. So there is that passion and there is that fire that still is there. But again, like Sarah had mentioned, nurses who are early career, we're seeing them leave the profession. Mid-career and late career are thinking of, retiring. And I think it's things related to staffing ratios, things related to things that we cannot control in terms of maybe not having the resources, not necessarily having better pay that we should be deserved of. And then I would also throw in the fact that, nurses feel very fearful to speak up. We don't have whistleblower protection laws or anything to support us to say, hey, if we're seeing something that's untoward, that we should speak out about it. We're kind of very unique in the situation where we're not really tied to anybody, and we can actually talk about the experiences and some of the challenges that we face within the profession. But there is a lot of fear about speaking out. But I think I'm hopeful that I do think that, there are more and more folks that are coming to the profession are excited to be there. And I hope we can continue to provide great examples for more nurses to come to the profession. It's such a rewarding job to have.
Well, that's inspiring me, and I'm sure you're continuing to inspire a whole bunch of young people across this country who know that so many young people are looking for something meaningful to do with their lives, and I can't imagine anything more meaningful than being a nurse. Perhaps being a school teacher, but again, I'm biased on that one.
Yeah.
Okay.
Well, thank you so much for taking the time during Nursing Week to speak to nurses. I hope that many nurses across Canada have the opportunity to watch this episode and to, see that, we do have political leaders that are interested in talking to nurses. So thank you so much for taking the time today. This was such a enriching and such a great experience to speak to you again, Prime Minister Trudeau.
Thank you so much. It's been an honor.
No, thank you both, and great. Best of luck with the book. I know it's doing great already. Congratulations on the new baby, Amie. I know that's a big deal as well. And just keep it up in every way, shape, or form. We need you. Your country needs you. Stay positive, but stay challenging as well of the system. That if you're busy giving your best out there for your patients, the country better be giving its best to you as well.
Thank you. We appreciate that. We'll stay gritty for sure.
Definitely. Persevere, courage, strength, all that. It's exactly right.
Yeah. Thank you so much.
Attention hospital employees and retirees in Canada. Picture this: a benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan, a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more.